The cavalry has arrived. 3 doctors and 6 nurses from Newfoundland and Labrador to be deployed in Toronto area hospitals. Among the team members, the Premier's wife, who's an emergency physician.
I will be in a COVID ward in one of the hospitals. So actively caring for patients with COVID-19.
The Canadian Armed Forces are also assigning 9 ICU nurses and up to 3 medical assistance teams to help. The need so great in Ontario that beds in big tents are now in use outside Sunnybrook Hospital.
Sending men and women in uniform to help in Ontario is a serious step. We're doing this because the situation requires it.
As in previous waves of the pandemic, Ontario doctors are prepared and trained to decide who gets critical care. But it's not like a train crash, says one doctor, where everyone needs help the same day. There is optimism hospitals will not have to triage critically ill patients.
When you're getting 1,000 critical care patients spread over the course of weeks, which we are here, then there is an opportunity to adapt the system and grow capacity.
And there is reason for optimism in Ontario's brutal third wave. The average in new daily cases passed 2,000 a month ago, 3,000 on April 8th, 4,000 on the 14th, and peaked at almost 4,400 April 17th. But it has trended lower since then. The 7-day average today fell below 4,000 for the first time in 2 weeks. Hospitalizations and ICU cases continue to rise, but could start to level off in a couple of weeks if we're careful.
I think we have to continue to make sure we don't relapse and go back into a state where we don't have enough healthcare facilities to take care of these patients.
For now, Ontario is getting much needed help from Newfoundland and Labrador, where people have a history of lending a hand.
It's just the way that Newfoundlanders are. They are giving to their communities, both locally and in their own country and abroad.
A heartening gesture from a small province to the biggest. Eric Sorensen, Global News, Toronto.
Last week, Ontario Premier Doug Ford promised his government would finally set up a paid sick leave program, which essential workers desperately need. He claimed it would be the best program anywhere in North America, bar none. Well, today we did get a bit more information, but Ontario is not launching its own program. It wants to piggyback on a federal one, and Ford's promise is turning into a bit of a political fight. Global's Queen's Park Bureau Chief Travis Dhanraj is with me from Toronto. Travis, what is going on with this?
That is a question that so many essential workers in this province really want the answer to right now, Donna. And this has been a political football, paid sick days for months now. The Premier really not wanting to budge on this issue until, as you said, last week on Thursday, when he promised that this would be the best program in North America. So the expectations were fairly high for what this program would be. Well, the only plan that exists right now, as far as we know, is for the province to top up the federal program with an additional $500 for essential workers for a total of $1,000 a week. Now, my sources tell me that that is a non-starter, that the federal government has already let the province know that, and that they say that that is a logistical nightmare. Now, Deputy Prime Minister Chrystia Freeland's office put out a statement today, and that reads in part, "When Ontario is ready to mandate sick leave in provincially regulated businesses, as we have done for federally regulated businesses, we will be there to help." Now, the Prime Minister was asked about all of this today. Here's what Justin Trudeau said.
We are there to help Canadians. We have people's backs. We need to work together, and provinces need to look at the way to deliver sick leave directly through employers, which the federal government can't do.
So, Travis, does this get essential workers any closer to a paid sick leave plan in Ontario?
It doesn't, at least not for right now. There is no timeline in place. And the Labour Minister here in Ontario was asked about what an alternative plan is. He didn't really have any clarity on that. And this really brings into question the safety of workers going to work who don't have a choice to stay home. The Leader of the Opposition assessed where we are right now as a province.
To suggest that we have time to wait. I just can't believe that the government think that it's okay to continue to drag their feet while people's lives are literally hanging in the balance. Completely irresponsible. It's despicable, and they have to stop this political back and forth.
Now, this all comes with the backdrop of the third state of emergency in this province, and also as the Canadian Armed Forces get set to come on the ground here in Ontario once again. Donna?
All right, Travis Dhanraj in Toronto. Thank you.